Today we are going to load this layered zirconia crown fabricated for a young male boy with a history of fractured central incisor, right maxillary central incisor. So you can check the fit on this model. It's nicely fabricated. This is layered zirconia. All I would like to show you this fractured central incisor treated with post control. We had used prefabricated glass fiber post for this and dual pure resin cement for pore buildup and post cementation. So you can clearly demarcate. We are having ferrule effect with the original tooth structure here, and this portion is pore buildup material. You can see this. This is ferrule effect with the original tooth structure, and this is the core buildup material. You can appreciate a bit of post visible here. One major complication in this case is deep bite. Please close. You can see it. There is very less space available, so we have to adjust the crown a bit. But this video is for crown cementation, fitting check, and cementation procedure. So I will explain that. So we are going to check the margin of fitting oral cavity. So this is nicely fitting. Margin of fit is excellent. No margin of gap is there. We will check the palatal margin fit in indirect fission. So palatally also this is perfectly fitting, and we will check the occlusal aspect. Please close. Okay, so we are having high points over here, and we will calibrate occlusally later on after cementation. Please open. So here we are having cement over here. First of all, I will remove it. Check for the occlusion without crown. You can appreciate teeth are intercuspating. We are using glass ionomer luting cement for luting this layered zirconia crown. You can use glass ionomer cement, or you can use dual pure resin cement both for luting the zirconia crown. For all ceramic crowns, you have to use only dual pure resins. You cannot use glass ionomer cement. And for PFM crowns also, you can use both glass ionomer as well as dual pure resin cement. I will load this glass ionomer cement onto the crown, covering each and every aspect of the surface which will come in contact with the prepared surface. It gently without distorting tissues. I will wait for cement to set partially for removal. Isolation should be taken care of, as saliva can drastically reduce the bond strength and luting strength of the cement. So you have to do it in absence of saliva or any other fluid. As you can see, the material is partially set, so this is the best time to remove the excess of the material. I will just move my explorer from crown to the gingival aspect, and this whole of the material will come in one go. I will remove excess from gingiva also, and I will remove excess from palatal aspects also. See, this is bulk of material, and I will just push my explorer from tooth surface to gingival surface, and this material will come out in one chunk. one dry cotton roll to just rub this surface, and it will come polished, tight, magnetic, and shiny. Now you can see there is a gap between the molars and the teeth, as this crown is high occlusally. So there is occlusal interference. We will correct that, and then this gap will also be closed automatically like the pre-operative one. So now see that gap has been removed, been corrected properly with the occlusal calibration. So if you will not do that, there will be trauma from occlusion and periodontal health issues will be there. There can be fracture of the restoration, there can be fracture of the tooth, there can be pain in the repaired tooth or treated tooth, or pain in adjacent tooth.